Welcome to the Paytient Podcast, a series of conversations with innovators, HR leaders, and benefit advisors about how they're solving benefit challenges and building healthier communities by helping people access and afford healthcare. Hi, I'm Laura Cave. I'm excited to welcome Jessica Brooks-Woods of NABIP for a conversation about benefit strategies that bring employees more equitable access to care in the midst of an environment where costs are set to rise over the next few years. We know that over 158 million Americans, have health insurance through their employers, but almost a quarter of them are underinsured. They have insurance, but they can't afford to get care because of those out-of-pocket costs. And we know that health plans with high out-of-pocket costs have historically disadvantaged vulnerable employees who have less disposable income, less savings, lower credit scores. And so I'm really excited to hear from Jessica, her point of view on strategies that employers and benefit advisors can use to make healthcare truly equitable. So, by way of introduction, Jessica Brooks-Woods is the esteemed CEO of the National Association of Benefits and Insurance Professionals, the United States' leading health insurance association. Jessica is revered as the quote, velvet hammer in healthcare, and she seamlessly interweaves fierce advocacy with a sense of purpose, ensuring holistic value delivery across healthcare touchpoints. She's also a speaker, author, creator of the AI empowered RISE Health Equity tool. And we're so excited for our conversation today. Jessica, welcome to the show.
Thank you. I'm very, very honored to be here, excited to have this conversation, and looking forward to seeing how we can all collectively have an impact on all the issues that we mentioned. Hopefully, some solutions
Absolutely.
will come out of this too.
Yes. So, first off, I want to ask you, how did you become passionate about healthcare? And then, of course, you have to tell us, how did you earn the Velvet Hammer nickname, which is so great?
Thank you. I love talking about both of those. I'll start with why healthcare, why me, and how. My journey into healthcare, I was deeply personal. It's always been deeply personal from my earliest memories, even in middle school, being asked to do a career exploration. It was judge, neurologist, cardiologist were like these. And then honestly, I looked at how many years at this time, middle school. So how many more years of schooling would I have to go through to achieve these things? And I was like, oh, well,
Maybe
I'll
not.
touch healthcare, but maybe not in that way. But that's my earliest
Yeah.
memory professionally of when healthcare really was a top indicator for me. And there's a lot of things in my life that I believe shape that. I honestly believe I'm a strong person of faith. Most people who know me know that. I'm not shy about that. And I'm not, because it's a huge part of my value system. What drives me, what it matters to me is that I'm aligned with my purpose. And I believe that being in healthcare and impacting healthcare in the way that I have so far and how I want to is a part of why I was born and what I'm here to do. And because of that, it's when things get tough, and a lot of things that were mentioned as the challenges that we're facing in healthcare, I don't shy away from it because it's what I'm here for. And I really aim to be a solution. And some of my earliest memories is, losing my grandfather to ultimately brain cancer that started as colon cancer. And now, knowing what I know now about why we may avoid care and why we may have delayed diagnosis when we access the healthcare delivery system, the role that having adequate health insurance and the ability to pay, how that shapes how we interact with the system, whether we delay maybe the appointment or, ignore a symptom before actually being seen, and what that can do. And that oftentimes can cause your life. I've also been a recipient of the public health system, being on CHIP as a child when my family was on welfare. And remembering going to college and no longer being able to go to the doctor or to see a dentist. And that really mattered to me. It was so important to me. I remember my first job out of college was with a defense contractor, Lockheed Martin, and myself and a few other folks in the same boat as me just graduated having health insurance for the first time in 4 years of our lives,
Wow.
scheduled our appointments together. And we were so gung-ho to go to the doctor finally and to the dentist. And we're 22-year-olds, and that
Yeah.
mattered to us. And then, being right now, many of us have heard about the maternal mortality crisis in our country, and I honestly feel blessed and to be alive. I don't take that for granted that I'm alive as a woman in America and a Black woman in America, and having 4 healthy children and having had survived them. So these things are very personal to me. And when I look at it from an employer perspective, when I look at it from a broker perspective, I always see a human. I always see someone who matters. And that's what drives me. And that's what I think is necessary moving forward. I'm sure we'll get more into that. As far as the Velvet Hammer, this was a reputation given to me. It was a name provided to me. And it largely comes from this idea that there has to be a level of audacity when we're tackling these really large issues. And I have this unique ability, so I'm told, to have this firmness while also a softness at the same time. And it allows people to be held accountable while at the same time willing to still work with you and collaborate to move forward. And that's really birthed out of when I started at the Pittsburgh Business Group on Health almost 10 years ago. And at that time, ACA was just enacted 1/1/14. I started like November 2013, so it was like right on our heels. We had major changes in the healthcare system as far as access was being questioned for the first time. We had this open access market pretty much where you can go to the primary healthcare system. And now for the first time in the history in that marketplace, that was being threatened, so to speak, where you had to make a choice. And that choice would have disrupted care, continuation of care, vulnerable patients, people in their most vulnerable moments, cancer
Wow.
patients, maternity, whatever could have slipped through the cracks. And I wasn't willing to allow that to happen without taking a position. And that position at that time represented that voice of employers. And we were very clear about that being Switzerland isn't going to help us achieve the outcomes that we're looking for. And it just continued after that, is just being willing to be in rooms or say things that others maybe don't feel comfortable saying, or concerned about what may happen if they say it. And I'm willing to go there. And that's where the Velvet Hammer comes from.
I love it. That's great. So, um, congratulations on your new role as CEO. I don't know, not so new, but still relatively new role
I'm
as
still
CEO.
like 30 days or so, give or
There you
take a
go.
couple. So it's still pretty
Yeah,
new.
so super fresh. She's now CEO of NABIP, and I'm so curious if you can tell us a little bit about your agenda as you begin to take on this new chapter.
Yes. So stepping into the CEO role at NABIP, my agenda is quite clear, I think, and pivots around 3 core values: relevance, equity, and alignment. I'm
Mhm.
dedicated to ensuring that our organization not only remains essential, like is an essential, not just a cog in the system, not just a voice in the system, not just a participant in the system, but essential into how healthcare is shaped moving forward. That being, just a participant isn't okay. And really defining what relevance looks like now, which we are, and then what does essential mean moving forward.
Yeah.
I'm committed to ensuring that equity is at the table in our conversations, and it's not just like bolted on the side. That is built in and
Mm.
integrated into how we apply our knowledge and our expertise and our service in the marketplace. When I say alignment, I mean alignment holistically. Where our values are demonstrated in how we move as a collective in the marketplace, and that not only are we seen as the benchmark on how, when I say how, I mean, how do you lead and connect with centering the people, the ultimate people that our decisions, processes, strategies, procedures, and way of work impacts? How do we
Mhm.
lead where other parts of the ecosystem, whether it's insurers or PBMs or even the employer market, large group marketplace, or exchanges. Like, how do we lead with this example that that's the way we all need to move to make the impact? That's what I aim for
I mean,
as
you're
CEO.
talking about walking the talk,
Yes,
essentially,
that's
right?
exactly what I'm talking about. That's exactly what I'm talking about.
I mean, it's so
Nurturing an
important. Nobody
environment
needs
where
an
values
association.
enter.
Yeah, I mean, nobody needs an association that just is blah 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 over here. And there's enough of that, I think, in our industry. Uh, and I so appreciate that appetite for action, right?
Yes, yes, that's to
So,
me is a non-negotiable.
yeah,
We have to have action. We have to have impact. Yeah.
that's great. So, with 7 out of 10
Mhm.
employers expecting health plan cost increases over the next 3 years, this is sort of the hill we need to climb
Yes.
together. Americans are already deferring care due to cost at record rates. I saw a stat from Gallup poll that measures this every year. It's 38% of Americans said that they or a loved one deferred care due to cost, and that percentage is up 12 points since the previous year. So just in
Yes.
1 year, like I just can't comprehend that. It never keeps shocking me. It keeps shocking me to hear
Shocks
that
me too
stat.
as well. Yeah, and you can't
So
with the time we get used to that, then, we probably should bow out of
you're
the
right, you're
industry.
right. We can't become numb to what that
Mhm.
means. And so I'm confident that this is extremely challenging for the benefit professionals. And and I've heard it said cost increases is the wallpaper of the room that we live in. A
Mm.
benefit professional told me that. And he's right that it's sort of normal that costs keep going up. But I think what we're talking about here is different, is somewhat unprecedented. So and it's getting to a point where the old strategies don't really work the way that they did in the past. And so I'm just curious, like, what are benefit advisors doing to help their clients cope in this environment?
Well, thank you for centering the impact on people in this conversation, and what you do. Navigating, I would say, describe as tumultuous waters, right? Like, this isn't a small thing. These are lives. And I used to say, we're not surgeons, so we're not, we may not be in the life or death business, but I don't believe that anymore. When you talk about avoidance of care, or access is beyond having an insurance card. I
That's right.
served on the state exchange for Pennsylvania at one point, and our broader mission was to increase insurance access, that more people had a card that they can go to the doctor with, and our measurement of success was that no Pennsylvanians were without that ability to have access. But when you talk about the increased cost, access is beyond having an insurance card now.
Yeah.
At one point, that metric may have been the ultimate goal,
Mhm.
but now it's we have to redefine what accessibility really is,
Yeah.
and are we actually achieving that? And I think that takes, trust, empathy, and transparency, that we are more intentional moving forward in seeing the humans that we've always served in a different way, and that we're seeing them as living lives that they're aiming for equality or aspirations for themselves and their family, that their health care and their health status is essential to that. And what we do really does aid in them being able to achieve that. And the longevity that they're able to do that, and their life expectancy in a lot of ways, right? Like, if
Yeah.
you're avoiding care, so it impacts a lot. And I think the biggest transformation, in an accelerated way, is that benefits professionals and advisors are crafting strategies with that in mind, that they leverage a variety of choice in the marketplace
Mhm.
that does accommodate the different socioeconomic factors that may exist, as well as healthcare experiences that may influence the ability to trust the system that we are providing access to.
Mhm.
And, I can speak to agents, but I could speak to NABIP as well. Yeah, one of the many things that we're all in alignment with when I say choice is a variety of different plan types that are offered, and solutions that surround those options that actually consider the nuances of a family, nuances of an individual circumstance. We provide a lot of policy and advocacy. Right now, as you mentioned, it's been 30 days. In that time frame, I've been on the Hill with my team. Initiatives like HSA innovation is one of those things that we're looking at. And we're aiming at increasing and access and eliminating tricky eligibility conditions. For example, if your company who's really aiming to ensure good access for you primary care, and you have an on-site clinic and you have an HSA, today you can't access that on-site clinic. And if you do, you're not eligible any longer for your HSA plan that you may have believe is the right plan for you. Right. And so these are policy legislative things that we're looking at, saying this needs to make sense. Or if your spouse right now works for a total separate employer and has a medical FSA at another employer, you can't have your HSA at your own employer.
I learned this
right?
recently. Yeah. It's wild.
Right. It is very wild. I mean, we literally are in the wild, wild west with some of these things. And what agents who are on the front lines and understand this, I think, in a more intimate and unique way than probably anyone else. Even, I've represented benefits leaders for the last decade. They, of course, understand they're on the front lines. They're hearing from their employees, but they go to their agents to determine how to navigate it, what strategy do they use, who do they need to talk to. And the agents have a responsibility to have a relationship, of course, with the health plan, but from a legislative perspective, they need to be involved with NABIP and have a collective voice around these things that are getting in the way of access. I think also what's important is how we look at professional development. We're at NABIP, we're very proud of what our professional development, our certifications. We think they not only help you get your CEs, but they also, more importantly, help you be a better professional.
Right.
And I think it's necessary that we understand that things are constantly evolving and we have to maintain that. We're on top of that. And we play a big role in that. ACA alterations are a big example. It's not just what happened, a decade ago. We're continually getting updates to the ACA we have to keep up with.
Right.
Or offering new offerings like ICHRA, which helps you go downstream and providing choice. As a small employer previously of having less than 10 employees at PBGH, with ICHRA, I was able to actually provide choice to my employees and kind of talk the talk that we did in our mission and through our education with large employers, be able to wrap around advanced primary care around this ICHRA platform and provide more than one health plan that was the most affordable in the marketplace, and now offer multiple to my employees. To me, that's where the role of agents and brokers need to play, is how do we leverage the new options in the marketplace to provide greater accessibility and quality experience in healthcare. Another area that we definitely led on from a purchaser perspective on the employer side, as the market has evolved with high consolidation and especially in the hospital space, or facility site of care, and using that as a cost lever to ensure that you're getting high quality care at the right site of care, so that you're not being overcharged.
Yeah.
And this is a major issue in the industry, and one that we currently are advocating for, the site neutral bill that addresses the facility charges, where I've been going to this doctor, but now they're owned by this facility, and I'm paying a lot more out of pocket now, and my care hasn't increased. Wow. I don't have additional services. It's the same location and the same doctor, but because someone else owns it, I'm now paying a lot more. Me as an employer, I'm paying a lot more, and me as an individual or a household contributor, I'm paying a lot more out of pocket. It's taking away from other basic needs in my family. That's unacceptable. And those are things that agents are leading in and have to. I think we have to get beyond, traditional ways of helping people make choice. And it's so much more complex now that we have to take in these types of considerations.
Right.
Do we direct contract? Do we, what is getting in the way of you being able to access primary care in the way that you should be able to,
Yeah.
and maintaining those relationships? And I think those are the biggest things that we're being holding ourselves accountable to, and the marketplace, the public should be holding us accountable to as agents. And how
Yeah.
are we evolving in this complexity to help serve
Yeah.
you? And I'm really, really energized about that, and proud, honestly, to represent such a group because
Yeah.
it's very complex.
Yeah.
Yeah.
It's only in recent years that I've appreciated how much policy work and how many details there are to hammer out in how this should work. And it's not often not until you see those rules, written out and start practicing them that you find the places where it breaks down. And then we need to go back and advocate for changes. And there's plenty of places where those things can be improved. And I think ICRA that you brought up is a great example. And I'm so happy to see the changes that have happened there in the last 10 years. I remember 10 years ago, I was a producer with an ACA insurance company speaking to individuals, but they were interested in bringing on, well, what about me and my coworkers at this tiny company? Like, what can we do? And it was just this complicated space, and we weren't sure. And then suddenly now, not suddenly, through lots of work and time, this has been codified in a way that's really working for small businesses. And that's exciting to see.
Yes.
And I think it's an example of how we can take through advocacy and the work that you're talking about through organization through NABIP, these kinds of changes are possible.
Yes, I'm so glad you mentioned that. And our responsibility is to continue to level up,
Right.
right? Like,
Yeah, to
to
build
be
forward.
competent.
Yes.
Yes,
Yeah.
exactly.
So going back to this, the rising costs and sort of ensuring affordability and access. I'm curious if there are any like old tactics that aren't really working anymore and any new ones that you think are particularly promising?
I think that's a great question. So pre-ACA, we talked about old tactics, was this the traditional way of looking at underwriting,
Mm-hmm.
and how we had to ask individual health status questions basically to determine if you were even
Right.
eligible for coverage, right? That's an
Yes.
old model that many people that are in our industry have had shifted from. Right now, you're moving away from that, and by law, and now you're offering care in a different way, or accessibility opened up, and equity opened up, right? More people have become eligible, didn't have to be disadvantaged or didn't have to pay more just because of this health status. But we still are paying more. You just mentioned the prices are increasing,
Yeah.
but yet this was the right direction. And I think it's important that we, moving forward, learn from those things. Like, hey, we want greater accessibility, we want equitable healthcare, we want more people to be included than excluded. There is always going to be a price. What is that? How do we anticipate that moving forward so that we can account for that? And I think now we're accounting for it. We're saying, okay, we're willing. This was the price that was necessary to pay, but how do we address these increasing costs?
Yeah.
And I think comparison shopping is fading away. What we called spreadsheeting, and lining up, the health plans in our marketplace and just looking at discounts. That's an old model.
Right.
That's an old technology.
Yeah.
Is spreadsheeting and looking at discounts to determine value. And the new way is highlighting the human element of that one, and for including empathy in that, and looking at these other factors that may distract people from going to the appropriate place for care, getting the appropriate treatment, We have to look at utilization, not just cost and price. We need to look at what shoppable procedures there actually are. And so it's much more complex than spreadsheeting, which was totally acceptable at one point in time when things were much more simpler.
Yeah.
And now we have to not only look at how you line up from your pricing perspective and cost perspective and discounts, but what is your philosophy to steer people into the appropriateness of care and making values decision and advising on a values based lens and model. And I think that's a very interesting direction that our industry has had to take. I think also transparency is another opportunity that is before us, that we have much more transparency than we had prior in our careers as agents, right?
Right.
And yet we still don't have enough.
Yeah.
And so we're looking at how do we leverage the tools that are available to create transparency, not just with price shopping, but quality, and equip people, our customers, to be able to make decisions around that.
Right.
And and also I think we're in this unique space of being held accountable. And I've said this before in earlier parts of our conversation already, but how the CAA is one that we as an industry maybe initially had an adverse reaction, but has fully embraced it. And to the point where now we're saying, well, we need transparency, hospital transparency. We need transparency from the PBMs. Now
Yeah.
we're like waving this flag in the ecosystem and in the marketplace saying, you're right, transparency is necessary. And it helps us be better advisors and be able to have insight that we never had before for smaller groups, even when you talk about level funding and the trend around smaller groups going into level funded plans, having more access to data than they have before, or states having laws now that and regulation that you have to provide some access, or all payer claims databases, or access to information that maybe we didn't have 15, 20 years ago, right?
Yeah.
We're now leading, I think, or will be seen as a leader in this direction of transparency. And
Yeah.
that's very new.
Yeah.
We were handcuffed before, or we were even concerned about it before. Where now the new way of, let's embrace it. Let's not try to beat it, but let's figure out, well, how is this actually going to practically work,
Mm-hmm.
where we actually benefit from it.
Right.
And that I'm really, really honored and excited about that. I think also understanding that with the Medicaid unwinding, millions of people losing health insurance coverage right now, that's something we should all be paying attention to and care about. Brokers and agents are essential in helping to find options for people.
Right.
And that's a big thing. And I think when you talk about old versus new, that's an issue that is now before us currently, that again wasn't an issue 10 years ago. And how we level up or stand up or strategize or partner and even advocate from a policy perspective around that is essential.
Mm-hmm.
I think I heard a quote or a stat that 71% of enrollments have been attributed to agents and brokers. 71%
Wow. In the ACA space?
in open enrollment
Yeah.
period.
Yeah.
Yeah.
Yeah. It's so important. And I was one of those producers, and it was so important to be able to talk people through their options and help them leave that call with confidence, knowing that they were signed up for the right plan, and making sure that they
Yes.
knew how to use it. They knew how to make this choice, what they would need to do when they got care, how to stay in network. There were so many details there. And I'm personally super passionate about producers and navigators in that space who are providing um, advice and guidance, and actually in some cases doing the enrollment for folks who have a difficult
Yes.
time predicting their income, or who have complex immigration status or things like that, that it can make it really challenging. And
Yes.
especially doing that in the person's primary language, like there's so much that goes into making sure that people have coverage. And I've heard through our partners, I've heard on one side, people losing coverage because of Medicaid redetermination. Many are, we're finding, already have employer sponsored in coverage, which is great because it means that, you know, they've been kind of scooped up into coverage through their work. And then others hopefully are turning to the exchanges and the agents that are available to really walk them through that process of getting signed up. And in many cases, the subsidies that are available to them make it really affordable, which is a great
Yeah.
example of how this can work. But it requires that human connection to make sure
It
that we
does.
we catch everybody, right?
It really does. Our cultural competency, it's no longer an option.
Yeah.
And we have to work very hard, diversify our teams,
Hmm.
our workforce. That's an opportunity for the industry,
Yeah.
to be honest with you, is
Mm.
the diverse, actually pulling in people from our communities across the country with different lived experiences into the profession to be agents. And that to me is should be a priority of NABIP, and under my leadership will be a priority of NABIP. We Our average age right now in membership is about 55 at
Wow.
NABIP. We have a significant opportunity to pull in the, the next generation, or even I think an opportunity with all the women who left during the pandemic, left the workforce, they all haven't come back to the workforce.
Yeah.
But they may be looking ways that they can add a great value, have flexibility to balance family and work. And I think this is a great industry to get into,
Yeah.
where you understand as a decision maker, whether you were the employee or the wife at home, or not. Like, you've been central to ensuring you had the right healthcare coverage for your family. Who understands it more than those millions of women that we've lost
Yeah.
from the workforce?
That's
How do
right.
we attract them back into the workforce, bring meaning and value and the balance that they're looking for, and answer to the issues that had them leaving to begin with, and have them be a solution into where healthcare is being shaped moving forward? I think that's a great opportunity,
Yeah.
regardless of their age. And then we
Mm.
have another generation that are figuring out what do they want to do in life. And we know that Gen Z is a very valued centered generation.
That's
They
right.
they care about causes like sustainability, right? And global warming and other things. Equity. They care about diversity, equity, inclusion in a way that I don't know if we've seen before from a generation collectively, that it's so diverse, no matter what their racial demographic is. They come together and they want people to be included, and they want them to have a voice. Isn't that who we want in our workforce moving forward to shape healthcare? So I think that's a new that is coming, that I'm very, very energized about and looking forward to leading, NABIP being a leader in helping to redefine and shape the future workforce in our industry.
I love that vision. I think that's really compelling. I mean, that was my stepping into that role, which was only a temporary, it was supposed to be a temporary job during the second open enrollment ever for Obamacare. And that launched my career into healthcare 7 years ago.
Isn't that
So,
something?
yeah,
Yeah.
it's a
Yeah, I was
really
on the
great
other end
role.
of it. I would have been my family. I was 8 months pregnant when I started at PBGH. I had with my third child. I had two young children. Was married and left to lead PBGH, and they didn't offer healthcare. They had eliminated offering healthcare to the employees.
Ah,
I was 8 months pregnant, paid cash out of pocket for my last 2 months, and then 1/1, the ACA was in effect.
oh my
I
gosh.
went to a broker to help me and my family for the first. I never, up until that point, I either didn't have health insurance or was under an employer's healthcare. I didn't know how to look at plans on a marketplace. That didn't wasn't
Nobody
even
did.
a reality before, right? No
Yeah.
one did.
Yeah.
And I needed an agent to handhold me. And then during the next year or so, I did, as I grew the organization and brought on new team members, I pointed them to a broker that could help them until we were able to offer group insurance. That is how essential,
That's
our
incredible.
members are.
Yeah.
Yeah, and I have a personal
Yeah.
connection to it. I've personally been impacted by someone seeing me as an individual and then seeing my family's uniqueness and saying, this is how I can help you navigate. Here are the options, and this is what I think will work for you. And these are questions you should be asking to help you determine that.
That's great.
From a
That's
health
awesome.
literacy and health insurance literacy perspective, we need those tools.
That's right.
And that does come from largely the role of agents.
Wow. Well, I could talk to you all day long. I'm going to ask you one more question before we go. Think 20 years from now. What is your legacy from your time at NABIP?
Oh my gosh, 20 years. I literally was in a meeting yesterday with my team, and we had spoken about the next 10 years and really what does that look like, or what role do we want to play. And so when you're saying 20 years, I'm thinking, oh my gosh, let's get through the next 10. And I would say everything that we're afraid of now, including the role of AI and taking our place in the ecosystem, we need to figure out how to make our friend and ally. And 20 years from now, the idea of helping someone choose a plan, which we once called spreadsheeting, and looking at discounts or comparison, again, whether or not you have options in the state exchange or private sector, whatever it may be, technology will be able to do that for us. We need to see ourselves no longer in that role, and we need to see ourselves understanding data, having greater data competencies and skill sets, and knowing how to pull not just claims data, but also population and public health data. I think we will be partners with the public health system in a way that we're not today. One of the motivating factors for me in joining NABIP was that I wasn't only now representing employers. The healthcare, to me, is so segregated and disjointed. And my frustrations have come when I brought up major issues like the maternal equity issue I mentioned earlier to a health insurance company, and they point me to the Medicaid plan. And I have to point them back saying, no, this isn't just their issue. This isn't something you can just point your finger to and say, not ours. It's the poor people over there. That's their problem, not ours. You're employed by an employer. That can't possibly be your reality. In the future, we're leading that conversation and humanizing healthcare in a way that it hasn't been done before, and it's still not being done now. And that we're not working for technology, but technology is working for us. And we're the leading voice in how we actually shape what happens next. I think we need to work ourselves out of the current reality of our jobs today and redefine what a broker, consultant, and agent's role needs to be moving forward. And I hope within the next 10 years, we're starting to have models and options that really help us grow as small businesses. You have to think about it. I mean, the majority of NABIP's members are small businesses. Many of them are multi-generational. These have been passed down in families, right? Like grandchildren are now maybe leading some of these agencies. There's a lot to that. There's a connectivity to the communities that most people don't get a chance to have sitting in an office building at a large company.
Yeah.
So how do we take those experiences, bubble that up into models that actually work for all Americans? And that's where I see my legacy being for NABIP in the future, is completely redefining our role in leading and shaping the quality of life for the people that we serve.
That's incredible. I so appreciate you spending your time with us this afternoon, Jessica. Thank you.
Thank you. Thank you so much.
I'm Laura Cave, and this has been the Paytient Podcast. If you'd like to share feedback or contact us directly about this episode or any other, drop us a note at podcast@paytient.com. That's podcast at PAYTIENT.com. Thanks for listening, and we'll catch you next time.